Teresa Freed with Johnson County Government. It's our goal to stop the spread of COVID-19 in our community. We also want to make sure you have the latest information on our efforts. For data on how COVID-19 is impacting the county, visit our dashboard on jocogov.org.
We know that there is a lot of virus out there, especially in our county. If you look at the county website, you'll see very high numbers of cases being diagnosed each day. The risk factors for the complex type of COVID, that is, that would put you in the hospital, in an ICU, on a ventilator, are in fact related to things that you've heard about. Older people are at higher risks. Those who are obese, who have hypertension, who have diabetes, those people are at high risk. That does not mean that the risk of those complications is zero in young people, and we still see young people all around the country, including children, who get COVID and get severe complications, end up in the ICU, end up on ventilators, or dying. The issue is that you don't really know if you become infected, if that might happen to you. Your risk may be less, but it doesn't mean it is zero. But then looking at our overall rates of hospitalization, and especially ICU and ventilator use, and deaths of COVIDs, I think that we can kind of safely say, and people can see on our county Tableau website, that the number of deaths have not followed the increase in the number of cases, that the number of deaths has still remained relatively low. And part of that is because we have better treatments now than we did at the beginning. Well, on the other hand, it's important to realize that some of the complications that happen with people that have COVID have been things that have long-lasting effects. As an example, we know that COVID produces some kind of changes in the clotting system, so that people have, for instance, strokes and renal failure, ending up on dialysis, and those produce long-lasting effects. So when they happen to you, and they happen sometimes to quite young people, even though you might survive COVID, lifestyle could be very different after COVID than it was before. So these are all reasons to say, yes, we are getting better at treating COVID and preventing death, but that does not mean if you get COVID that very bad things could not happen to you. So it's important to do all we can to protect ourselves and each other by all of us wearing masks and reducing the transmission, washing your hands before you eat or touch your face or touch anybody else, and maintaining that 6 foot of distance.
For more information about COVID-19 in Johnson County, visit jocogov.org/coronavirus. You can also subscribe to a daily e-newsletter with the latest data and precautions being taken in the county and state.